Now, it's the 160th anniversary of the Royal Society for Public Health, and joining me today to look back, if not over 160 years, over the past year and of course to the future, is Chief Executive Shirley Cramer. Great to see you again, Shirley. We're not going to talk about the last 160 years, but let's talk about the last year. And what would you see as the main highlights?
Well, it's been a very interesting year and very mixed for public health. So we've been very concerned at RSPH about the drop in funding for public health in local authorities. And actually this was picked up by the Health Select Committee this year, worrying about the lack of investment in prevention. And I think all of us have been worried about that. So that was one huge piece of the puzzle for 2016. Another issue is the childhood obesity strategies, long awaited, but extremely disappointing at the end of the day because it didn't include marketing, promotion and advertising. So some disappointments and some concerns. But some good news too, and I would say that the standardised packaging for tobacco, we are only the second country to have that after Australia. And our smoking stats are very good. Our prevalence rate 16.9%. So we're going down. So that's, I think, good news for public health in the UK. I think other good news is that we have new guidelines on alcohol, which came out this year. We've also got this sugar tax. So who knew that we would have a 20% sugar levy and a potential for reformulation? And of course, we have Brexit. We have no idea what this is going to mean for the public's health. There are many regulations from Europe. We are working on that now with other people in the public health community, and we'll have a much better idea going forward what this is going to mean for us. And of course, we have a new public health minister along with our new Prime Minister.
All change. So there are a number of challenges. There are, of course, some successes, and there's a great deal of innovation around at the moment. What would you say you're doing to encourage that and champion it?
Well, innovation has always been really important in public's health because our challenges have changed. As you mentioned earlier, it's our 160th birthday. Challenges 160 years ago were about infectious diseases, and now we're non-communicable diseases are the risk factors, so drinking, smoking, air pollution, actually all sorts of what the food we eat. So we do have to be much more innovative in the way we think about things, and there's huge amounts of innovation going on across the UK. How we champion it is by having health and wellbeing awards, and what we're doing is outing that really good practice in communities across the UK so that it can be taken up in other parts of the country. We're also providing a brand new qualification to support innovation, so to allow lots more people to be involved in understanding what's involved in health improvement. And interestingly, another, I think, really important area that we've introduced this year is our Youth Health Champions, expanding that programme.
The RSPH has had a lot of headlines this year, hasn't it?
We have had a lot of headlines this year. It's been really a mega year for us. I'm very proud of the work that we've done this year. And I think there were two areas where we outed really issues as being a public health issue. So we had a very influential report on sleep, where we asked people to consider their slumber number, how many hours of sleep you get a night. Because we know from the evidence that sleep is a huge component of health and well-being. And I think our report that was all over the media, there was debate and dialogue and people began to think about it. I think the item that caused the most headlines, almost 500 million people saw our activity equivalence calorie labelling report. And this took us rather by surprise because it was an idea that we discussed. How do we affect people's behaviour? How do we make people think slightly differently in that 6 seconds that they've got to choose their lunch? So the idea of having little stick figures with the amount of time it would take you to walk off the calories in your packet of crisps or your biscuit really caught the public imagination, and we're hoping to take that idea forward over the next year.
Your remit is so huge. We look forward to exploring many of the subjects we've just discussed over the course of this programme. Thank you very much indeed.
Thank you.